This is a production of Cornell University.
Hi, thanks to all of you for being here in person and over Zoom. I've really enjoyed the last 2 years that I've been able to spend with the horticulture section at Cornell. Dawn, you have been a fantastic advisor, and I'm just really appreciative of the chance to work with you. Janet Lobach is my other thesis committee member. She's in human-centered design. She couldn't be here today, but I'm also really grateful for her presence. They've both been guiding lights during my time here. And I want to thank all of you for being here today on such a gorgeous day, last day of classes. Thanks for being here inside with me to listen to this presentation. So I first became interested in environmental psychology, which is what we're going to be talking about today, when I was a medical student. By the end of my second year of medical school, I was very stressed. I had actually developed physical symptoms of anxiety, namely heart palpitations and migraines. And I had already decided to do a year-long research fellowship through my school. And through a series of happy accidents, I ended up for part of that year on a small island town in Alaska. And I liked it so much, and I felt so healthy there that I decided to stay for a while longer, actually a year and a half longer than planned. And this is, wait, sorry, one sec. Oh, there we go. This is what I saw every day on my walk to work when I lived there. This is from a hike that I would go on regularly. And this I saw on evening strolls 5 minutes away from where I lived. So research predicts that on average, you in this audience, just from having looked at these photos, will have experienced an increase in your parasympathetic nervous system activity. That's the part of your nervous system that kicks into gear when you're doing anything relaxing, like eating, sleeping, meditating, that sort of thing. If shortly after viewing this, you experience a stressful event, which I hope won't happen, I hope this is not a stressful talk for you, your heart rate and blood pressure will of course go up because of the stress, but it'll return to baseline more quickly than if you had looked at pictures of a city street or a building. And then furthermore, just looking at images like these for about 40 seconds can increase your attentive capacity for work-related tasks. So when I was in Alaska, I rarely measured my heart rate or any of these other metrics, but within a few months of living there, I remember thinking to myself, wait, I haven't had a heart palpitation in weeks. And so I finally returned to medical school, and of course the differences were striking. One of the things that I found myself missing most was the physical environment of Alaska, the lushness, the beauty, especially in contrast to the 12-hour days I sometimes spent working in windowless hospital spaces. And ever since that time, I've been interested in ways that our contemporary Western medical system can integrate the natural world to benefit patients, healthcare practitioners, and the natural world itself. So I can't cover all of those goals today, especially how Western medicine can start to take care of nature. That's a huge topic, by the way, because American healthcare is responsible for about 9% of US carbon emissions. But what I do want to talk about is how healthcare and medical education currently conceptualize nature as it relates to health, as well as historic precedents for nature between Western medicine and the natural world. And then I'll talk about how current theories, research, and design help us to understand the role of nature in the workplace. And when I say nature, I realize that I'm using a term that has vast meaning, very different meaning potentially for different people. In my line of research, nature is any, quote, natural element with which we interact. So that could be a forest or a potted plant. And I realized that potted plants can come with complex social meaning. They're more curated, they're more domesticated than something like a forest. But in theory, they still carry with them the essence of something greater. They're ways of bringing the natural world outside, indoors. And then finally, we'll hone in on these three topics of health, nature, and the workplace to talk about the results of my thesis project, which looked at the effect of indoor plants on the wellness of outpatient primary care workers. So first, I think it's important to think about how Western medicine conceptualizes health, because I think that trickles down not just to interactions with patients, but also what healthcare looks like, including design of healthcare facilities and the priorities that are set for workers. Two common models for understanding health are the biopsychosocial model and the socioecological model. They were revolutionary for their times. They both came out in around the 1970s. And at that time in medicine, Western medicine had been very fixated on the biomedical model. This idea that our health is entirely the product of our genes and our age, our biological sex, and its direct interaction with the healthcare system. But we know from intuition and from decades of research that our health is much more complicated. Our mental health, our relationships, our communities, national policies, and society at large all play a role in our well-being. So the biopsychosocial model, as far as I have seen in practice, does not leave room for the natural world. The socioecological model, if it does mention nature, it's usually in the context of natural disasters or climate change. So nature, I would argue from these models and from personal experience in the field, is portrayed in medicine as a potential source of disease or injury, but not necessarily as an ally in our healthcare. And when we step into contemporary healthcare spaces, I think it's safe to say that they're stereotypically devoid of anything that's obviously related to the natural world. Certainly, some pharmaceuticals, from aspirin to a class of chemotherapy drugs called vinca alkaloids, are derived from plants. And for anyone who wants medicine and horticulture trivia, aspirin from willow, vinca alkaloids from Madagascar periwinkle. But when you think about the day-to-day experiences of patients or workers in outpatient or inpatient settings, unless you're familiar with very contemporary medical design, I imagine that you think of spaces like these. Please let me know if you feel otherwise, of course. So I should note that other medical and healing traditions acknowledge the relationship between the natural world and our health more than the Western medicine does. But those systems such as Ayurvedic medicine, Eastern and Western herbalism, et cetera, aren't my areas of expertise. However, there is a very rich history between nature and Western medicine, the plant world in particular. So this is a very short list of physician botanists, physician naturalists, and other medical professionals who played important roles in our knowledge of, in Western knowledge of the natural world. So I included in this list some names that I thought that both horticulturalists and then maybe medical professionals would recognize as well. And a few of these people played important roles in the development of botanic gardens in Europe and in the US. And of note, a lot of botanic gardens were actually started with the interest of medical professionals in mind, the interest of their education in mind. So much of the interest in plants during the eras that these people lived was in their potential as pharmaceuticals. But today there's a lot of research suggesting that increased exposure to the natural world is good for us with or without ingesting plants. So I've looked at a number of these studies, and while they really vary in research quality, I think the overwhelming evidence points to the idea that our interactions or lack thereof with the natural world can have an impact, a sizable impact on our well-being. This shows you the varieties of ways of evaluating health that have been explored, from risk of developing depression to risk of giving birth to a premature infant. One compelling article that was published within the last year found that it was a meta-analysis, and it found that just a very small increase in the amount of green space we live near can lead to a 3% reduction in cardiovascular mortality and stroke risk. So just even small fractions can play a big role in our health. And there are so many studies out there. If any of you want me to send you some that I found particularly compelling, I'd be happy to do so. Just let me know afterwards. So a subset of nature and health research is focused on nature in the workplace. And considering that the Environmental Protection Agency estimates that the average American will spend 90% of their life indoors, just think about that for a minute. This is a really important line of research, I think. And much of this research involves potted plants. It has found increased ability to concentrate, improved verbal task performance, better mood and more rapid declines in blood pressure after stressful tasks when potted plants are nearby. And indoor plants in workplaces have also been associated with greater employee satisfaction, with enhanced self-reported quality of life, by employees, reduced health complaints such as fatigue and chronic pain, and fewer sick days. There's also a subset of environmental psychology research that is focused on outcomes for patients who are exposed to indoor plants and other natural elements compared to typical healthcare settings like what we saw earlier. In the early 1980s, a study was published that really propelled this whole line of research. And it found that people recovering from gallbladder surgery had shorter hospital stays and lower use of pain medication if their views looked out onto greenery compared to a brick wall, which was the other view in the hospital. So this translated to, on average, a full day spent less spent in the hospital, which is actually huge in terms of risk of hospital-acquired infections, and then, of course, the cost for the hospitals themselves. And then subsequent studies have found very similar results after different surgeries if potted plants were the natural element someone was exposed to, not just views of greenery. And then other studies of indoor plants on patients have tended to focus on seniors with comorbidities such as hypertension and dementia, and found positive results for those as well. One of the most important theories that underlies this research is called biophilia. I'm just curious, how many of you have heard it? I realize it's a pretty common term today, yeah. For anyone who hasn't heard of it, it's a term that psychologist Eric Fromm coined in the 1970s, but it was modified by E.O. Wilson to mean, quote, the affinity of human beings for other life forms. So why does nature seem to reduce our stress levels? Why is it seem to be inherently beneficial for our immune health, for our children's development, et cetera? It's because we evolved in natural settings, says this theory. We are biologically wired to feel at home among forests or the desert or the ocean side. And admittedly, many of us don't feel at home in those settings because of our lived experience, but our biology suggests otherwise. So many industries are getting on board with the idea of biophilia, or biophilic design specifically, especially having indoor plants in the workspaces. So you might have heard of the Amazon spheres. They are 3 massive biodomes at the Amazon headquarters in Seattle, and they were built according to Amazon as, quote, a direct link to nature for their employees. They feature over 40,000 plants. Most organizations can't afford to do that, but they are opting for much smaller scale biophilic design, such as just having a lot of plants in the workspace or living walls. So now that we've had a little bit of background, I'd like to talk about the results of my thesis project and then the research that I've been doing for the last 2 years. So as I mentioned, there are many studies in this field focused on office wellness and many others focused on patient wellness, but very few, and in fact, only one that I've heard of that looks into the way that indoor plants can affect healthcare workers themselves. So we approached Cayuga Health, which is a large local healthcare organization, about the idea of a pilot study to look at the effect that potted plants placed in offices would have on professional wellness, namely burnout levels. And burnout is a term that's been around for actually a very long time, but it was formally introduced in academic literature in the 1980s. And so we now know that anyone can experience burnout in any field, but it was originally studied in fields that have, even today, some of the highest burnout levels. So that's medicine, social services, and teaching. And today you've probably heard news about burnout in medicine. The Great Resignation of COVID hit medicine particularly hard. A recent study found that 1 in 5 doctors plan to leave the field of medicine within the next 2 years, and 2/3 of nurses plan to leave their current position within the next 3 years. So the American Medical Association is now calling burnout an epidemic. The dimensions formally defined in literature are emotional exhaustion, depersonalization, which can translate as cynicism toward colleagues or reduced sense of caring toward patients. And then a reduced sense of personal accomplishment or efficacy. So that often translates as a sense of having no agency in one's organization or reduced competence, totally subjective and self-reported. But our research question was, can the presence of indoor plants in medical offices reduce the risk of burnout for healthcare professionals? So we approached this as a pilot study, as I said, and we were trying to gain information about how feasible a study like this could be. So that made having a qualitative component particularly valuable. We randomized 4 primary care clinics into treatment and control groups. Treatment had 2 months with plants added to their offices, and control was baseline, having no plants or maybe very few, like a plant in the office manager's room, for instance, but everyone started with very few plants. So we administered a survey to all workers except for the office managers because we were working with them directly at the beginning of the study before plants were added. And that consisted of demographic data, the seminal survey for burnout research called the Maslow Burnout Inventory, and then the abbreviated nature relatedness scale, NR6, which asks about a person's sense of connection to the natural world. And after the plants were placed in offices, a month later, we re-administered the survey. And then a month after that, we administered the 3rd survey, consisting of the same questions. And then the offices were allowed to do what they wanted with the plants, and many, many workers ended up taking them home, which I thought was pretty nice, actually. So the qualitative portion we held after the surveys, a couple months afterwards. And I held semi-structured interviews with 13 participants. We explored people's experiences with burnout personally, their attitudes and experiences with nature, with indoor plants. And for the treatment participants, we talked about their experiences with having plants in the office space. And then I analyzed the transcripts with in vivo software using immersion crystallization method, which is an inductive thematic form of analysis. I was interested in primary care in particular because primary care clinicians tend to have higher rates of burnout than clinicians in other fields, especially in the outpatient setting. So each group, treatment and control, consisted of family medicine and internal medicine. As you can see, family medicine offices tended to be a little bit smaller, 13 and 16 total workers, respectively, and then internal medicine a little bit larger. And the range of total workers at each of the office was between 13 and 25 people. So just to give you a sense of what these clinical roles mean, administrative staff, that refers to front desk workers and medical record workers. Clinical support are nurses, medical assistants, and laboratory techs. And providers are nurse practitioners, physicians, and physician assistants. And I should also note T2, one of the treatment sites, was the site of an internal medicine residency clinic. So trainees were rotating through. So that's why you see a slightly higher number of providers, because we had more providers rotating through at the time. We received donations of indoor plants, very generous donations from 3 local nurseries. And this is the list of plants that we featured. As you can see, they're plants that are often used indoors and tend to survive in low light conditions. And so, yeah, very grateful for the nurseries for that. This project was clearly not an equivalent of the Amazon spheres. We had very limited budget. We weren't even interested in design per se. We were interested in the question, do plants themselves, even not in nice pots, even not in snazzy living walls, if they would impact the experience of workers? So we had to be very subtle in our placement of plants because maybe you've seen, if you've been to an outpatient office recently, they tend to be pretty tight on space as is. And so we aimed for a plant density of, quote, 1 small plant and 1 large plant per 6 meters squared, which is recommended by the Rural Development Administration of South Korea. It's the most common recommendation that one finds in this line of research. But ultimately, we just had to be very flexible based on the needs of the clinic. We were working with the office managers directly to place plants around the office, so it was really at their discretion. As you can see, we placed plants in areas that were noticeable, but presumably not too invasive or problematic. Even this gorgeous philodendron, according to the office manager, that cabinet was never used. So we were able to place it there, which was nice. Let's see. So this is a breakdown of response rate across the 3 surveys. I was a little disappointed in our response rate, but considering what I know of healthcare workers and how they tend to respond to extra administrative duties, I think overall this was pretty solid. We had a 49% response rate for survey 1, 42 for survey 2, 37 for survey 3. And the treatment sites were slightly better at filling out their surveys than the control sites were. And one of the control sites had a very dramatic, unfortunately, decrease in respondents from 52% survey 1 to 24 in survey 3. An important and unforeseen event that happened during this was there was huge managerial turnover in all 4 sites during the study. So treatment site 1 started with a brand new manager. As you can see, they have the most consistent response rate across the board. Treatment site 2 and control site 1 lost their managers during this treatment site. And then control site 2 had major managerial restructuring. So I think that contributed to the decline in response rate. And then we had also been working with the office managers, and our original design was to have the same people take the survey, all 3 surveys. We would be able to track individual responses and have better statistical power from that. But unfortunately, there was just a lot of turnover, and there was attrition and then new respondents in each survey. So it's how it goes in healthcare, I guess, sometimes. So when we look at the numbers from the survey, I think we see interesting trends that are subtle and that they're not statistically significant, I should note. But they're interesting to look at and ask what would happen if this pilot study was able to grow into something larger. So this figure is a summary of control versus treatment site burnout scores. As you can see, control in blue creeps upward over time in their burnout scores, and then treatment site stays pretty much the same over time. We also explored whether the treatment had different impacts but according to one's professional role. So I found this figure particularly interesting since providers here seem to have had a very noticeable increase in burnout in the control group and decrease in burnout in the treatment group. The other professional roles are a little less clear, although clinical support also definitely creeps upward in their control group. So one thing that struck me about the layout of the clinics is that the provider rooms were distinct unto themselves, and they had more space than where a lot of the administrative workers and the clinical support worked. And that's very common in most outpatient settings, actually. So it meant that we were able to put a slightly higher density of plants in the provider rooms, as in we basically had unintentional lack of equity in terms of plant distribution. And so, of course, it's possible that these trends had nothing to do with the plants, but I think it's a really important thing to be thinking about if a study like this were to become larger. So we also wanted to look into nature relatedness scores and how they might relate to burnout. We ended up splitting NR6 scores into high and low groups. And as you can see, people in the high NR6 started with pretty similar burnout levels, whether they were in the treatment group or the control group. And the control group kind of crept upward a little bit by survey 3, but overall pretty similar. When we look at the low NR6 grouping, the control group definitely creeps upward in terms of their burnout score. The treatment group starts lower, goes up a little bit, and then comes back down. So the treatment and control low NR6 started with pretty different burnout scores. So I think there's potentially something totally different going on here. But I do wonder, like, is it possible that that the presence of plants indoors played a bigger role for low NR6 individuals than for high NR6? And remember, NR6 is referring to someone's sense of nature connectedness. So a low NR6 might mean that a person just doesn't see themselves as a nature person. Maybe they live in a more urban or industrialized area, or maybe they work so hard that they just don't have a chance to get outdoors. So I think all of these are interesting trends, and they really warrant greater statistical power, ideally with a larger sample size before we can feel more confident drawing conclusions. I think that the qualitative study allowed us to explore more robustly issues related to burnout, workplace wellness, and attitudes toward the natural world. And then for the treatment group, of course, their experiences with plants in the workplace. So I was really impressed that although only one person mentioned the official definition of burnout when I was asking people about their experiences, everyone's description of their own or their colleagues' burnout could fit into the official definition of at least one dimension of burnout. And they were incredibly poignant. And I'll just read one for the sake of time. One clinician said that they were currently very burnt out, and their words were, "I don't care anymore." And that's scary. I mean, that's terrible. It's like I just let things go. They aren't emergencies, but also I just let things go. And that's really classic depersonalization of not being able to muster enough caring to put, the extra work in. All of these interviews I thought were very visceral and poignant about people's experiences. We spent a good amount of time discussing people's experiences with the natural world, and indoor plants. So the following slides are a couple important themes that I thought I wanted to share with you guys. So one was the idea of nature and indoor plants as inherently therapeutic. And only one person mentioned that they knew about research in environmental psychology, but everyone had personal experiences that seemed to refer to some aspect of a therapeutic element to plants. So a clinician in the treatment group said, "One day there were plants everywhere, and it seemed like the best thing ever. You could see it in everybody. It was great. Indoor plants make you feel good." And then I had a really enjoyable interview with an administrative worker in the control group who was a home indoor gardener themselves. And they described taking care of plants to a benzodiazepine. I thought it was great. It's my way of either taking a Xanax or I go water my plants. After a while, it's like you got to figure out some way to do it on your own. And my way of doing it is my plants. And then another clinician in the control group said, the treatment group said, it was definitely something which was calming. It felt good to have those things, the plants, around. Hominess and familiarity was another theme that came up. I thought that was interesting because to me, it really connects to biophilia, the idea that we naturally feel more at home in a setting where we can relate to other organisms. So one clinician in the control group imagined their ideal clinic as, quote, "Just some more of those kind of homey touches would be fun. I think that plants would be nice to add some kind of warmth to different areas and make it feel a bit more homey." The word homey and hominess came up many times. I was actually quite surprised about that. And then an administrator in the treatment group said this about a philodendron that was still in their office. "We named her Aubrey. Yep, I greet her every morning like, 'Hey girl, you're looking good.'" And to me, that's classic biophilia in a lighthearted way. And then a clinician in the treatment group suggested that the plants led to more conversation with other staff. It was a great talking point, they said. When we'd go to the nursing stations, they would be like, "This plant is doing well today," or "This is not." And that site, unfortunately, had a mealybug incident with the Swedish ivy at the nurses' station. So, but nonetheless, it apparently promoted community or somewhat more animated conversation, I guess. And community is actually something that has been studied with respect to nature and health. So a third theme that I'd like to share is that of escape. Attention restoration theory is another theory that underlies this research. And it says that time spent in natural spaces is cognitively gentle in a way that restores our cognitive function. It allows us to step away from stressful human-built settings, and it creates a positive distraction from whatever might be going on in our minds. So some of these quotes, I think, speak directly to attention restoration theory. One person in the control office said that plants were, quote, just something to get you to escape for a few minutes. My workplace is sterile in the sense of there's nothing to look at. But when you look at a plant, there's always going to be something different about that plant. And then a clinician who owned a farm said that being out in nature, doing something outside, kind of reminds me of the bigger picture of the world. It's just comforting to know that things are moving and growing and living outside of the day-to-day of work when it's really hard. And then finally, an administrative worker in the control group found being outdoors incredibly important for their health, and also said that they wish their colleagues would experience it more too. And they said for them, the value was just stepping away from this, taking technology away and just being present and taking a breath and just being. So I didn't specifically ask people if they thought that plants could reduce burnout, because I was trying to avoid leading questions in these interviews as much as possible. And only one interview participant made the direct connection themselves between nature, biophilic design, and burnout. But nonetheless, the vast majority of workers saw nature, whether it was outdoor nature or indoor plants, as beneficial for their mood, for creating a sense of hominess, for offering a chance to step away from the dullness or the stressors of work. And then the treatment participants, I think importantly, reported universally just really enjoying having the plants around. So to wrap up, I felt that our research showed potential of indoor plants to improve mood of workers, possibly reduce burnout symptoms. We had a lot of promising data, I thought, from our qualitative interviews, and we saw intriguing, if not statistically significant trends in the surveys. And then from a feasibility standpoint, I think that a larger version of this would certainly be possible with just a few modifications. Strengths of our study, I thought, were our randomized design, our ability to compare clinics of similar sizes and specialty, and then a very robust qualitative component. I think the weakness was in the powering. If a future study were to occur, I would want more clinics involved, ideally, and then a way to ensure follow through of individual participants. And speaking of future directions, besides a study that allows for better statistical power, I would hope that there would continue to be research around the interaction of plants with other forms of workplace wellness, and then the impact on outpatients, and then the therapeutic relationship between clinicians and patients. And to my knowledge, I don't think that this latter point has been studied at all, and I'd be really interested and hope that happens in the future. So there are a number of nature-based wellness programs that throughout the US that encourage patients to spend time with nature, such as Nature RX here at Cornell, which I hope all of you have heard of or maybe participated in yourself. Park RX, which is a national program that encourages people to get outside into parks of state, local, or national parks. And then many prescription produce programs. There's at least one here in Tompkins County. And those really often support local agriculture too. And so I just hope that healthcare organizations will see more and more the value of these types of programs for their employees, not just for their patients. And then this last point, I'm calling, for lack of a better word, ecocentrism. That's in contrast to anthropocentrism. So I think the branch of environmental psychology that I'm in walks a fine line between acknowledging this very powerful connection between nature and human health, and then treating nature as an inanimate pharmaceutical to be used solely for our benefit without an inherent value unto itself. And so earlier, I briefly mentioned other systems for understanding health besides Western medicine. And I just really think that healthcare and environmental psychology, as it relates to the nature health connection, can learn a lot from other systems and cultures that have tended to hold less extractive mindsets toward the natural world. So this is a photo from a hospital outside of Detroit, Michigan. I recently got a chance to meet the former CEO of this hospital, thanks to a design class here at Cornell. And I just think it's a beautiful example of the way in which horticulture can fit into contemporary healthcare and promote positive environments for patients and workers. And I should note that while this person was CEO, the nurse turnover rate at the hospital was 3%. And that was in contrast to the national average at the time, which was 50%. And this was before COVID. And so he instituted a lot of policies that I think promoted greater employee satisfaction. So I'm not saying it was all this that did it, but I think it's a lovely example of what is possible in healthcare. And so just want to wrap up with a lot of people to thank quickly. But Ponto's Greenhouses, Schaefer's Gardens, and Dillon Floral, they were the people who donated the plants to us. I owe them tremendous thanks. They were so generous. New York State Flower Industries sponsored us. Cayuga Medical was so easy to work with. And Ken Subin was the chief medical officer at the time, and this would not have happened without him. And then I have so many faculty members to thank, Don and Janet particularly. As I said, you've been wonderful to work with. And then others too, who I think have really welcomed me, supported me, and inspired me at different legs of my time here at Cornell. So thank you. And then many family and friends, but especially my parents who gave me the last name of Green. I'm very grateful as a horticulturalist for that. And then my wonderful husband who's been with me this whole length of the time here. And if you have any questions that percolate later, or you don't have a chance to ask them, please email me because I'd love to talk about this. So yeah, if anyone has any questions, please feel free to ask. Yeah. Oh, yeah.
So my wife works at Cuco Medical. I get to hear about those 3 aspects of burnout every night.
Oh, wow.
But she came home about a year ago with a really beautiful Christmas cactus. Where'd you get that? Oh, from the hospital. They told us that the plants weren't good for the patients. So we had to get rid of them. I told Don that, remember? I was shocked. I told her, so you got to find out the source of that because that's really not true.
Yeah.
And so as it turned out, up the line, the issue was they couldn't find anyone to take care of the plants, or they felt it was a burden to take care of the plants. So it seems to me that a hospital ought to hire somebody whose job it is to populate the rooms with plants and take care of them, take that burden off of whoever, custodian or a nurse or whatever. Because if it's true that it reduces patient stay, like every day in the hospital is $10,000 saving it, right? Somebody. And the recovery rates and all that, it seems like it's really worth the investment.
Yeah.
So I wish we could have a pilot where we actually looked at somebody for like 3 months, where that was their job to take care of the plants. And then hospitals have records of all this. You can have controls, you can compare the patient outcomes in those situations. But I was really surprised at the misinformation about plants and others somehow it's bad for people. And then also that nobody wants to take care of them. And that's a barrier to adopting these things you're talking about.
Yeah, thank you for sharing that. That's really interesting to me for sure. And I love the idea of that study, or future study. I think that I have encountered in other settings that belief that plants are somehow dirty because they have soil in them, or actually often soilless substrate, right, in them, and that they're somehow not healthy. But I think you're right that the big barrier is that people feel so stressed and they feel like it's going to be an added burden to them. I actually didn't share a quote, but there was a clinician who really loved the plants in the treatment offices, and but said that when they first arrived, it was the immediate impact was great, and then suddenly this fear set in, and they thought, oh my gosh, who's going to take care of these plants? And they said, I know that our organization had been talking about, oh, let's address physician wellness. And then this person was like, great, so throw a bunch of plants at us and expect us to take care of them and like add to our workloads. then they found out that someone else was taking care of them. It was fine. But yeah, I think that the biggest barrier probably is stress levels of workers, even though, sorry, one point, even though there is definitely evidence that direct interaction with indoor plants, rather than just having them around you, but actually repotting them or watering them or nurturing them in some way, has more positive effects on us than just having one nearby. So.
Well, to Marvin's point, I know that there's also a traditional and totally erroneous belief that plants deprive us of oxygen.
That's true.
So that when they're in a closed room, we have less oxygen. Of course, that's the opposite of what is true.
That's a good point. I found this wonderful book from 1887, published by an MD PhD who is a big fan of houseplants or indoor plants, and spends half of the book trying to disprove that theory, actually, because it was around in his era and it seems to still carry through today. Although I think a lot of people do see plants as being beneficial for the air quality, and there's, I think, mixed data about that. I would want to research that a little bit more, but yeah.
So being a geek, I understand what your situation was. There just wasn't hundreds of people to do this with, right?
Mhm.
So how did it go with the trial set at such a low number, and all of a sudden, here's all these plants, and then some people didn't get them? How did you couch that?
Wait, say that one more time. Sorry.
So some people had the plants and some people did not, right?
The two clinics.
Areas.
Yeah.
So how did that go? In other words, and then you're giving them surveys and things.
Mhm.
How do they not know what's going on?
Oh, that's a great question. Yeah, we couldn't fully blind this. And that's, I mean, I suspect that plenty of people knew that there was something, they get the survey about wellness, and then 5 days later, they get a bunch of plants in the office, and so we were thinking about that. And then just in most of these studies, there's no way to officially blind people from the treatment because you're supposed to see it. That's
Yeah.
part of the thing. And so, yeah, but in terms of trying to keep the full nature of the study under wraps, I think we did pretty well. We asked the office managers to share it as little as possible. When I interviewed people, it seemed that most people didn't have a truly robust understanding of what our exact research question was or anything. So I think we managed to keep it under wraps. And I always went in after hours. So every now and then I would interact with a few employees, but for the most part, especially at one office, I never interacted with employees, just with maintenance who came in. So it was trying to stay as stealth as possible. So yeah. Does anyone have any other questions or?
There could be, this is a little big plant, but there could be a before and after experiment in Bradfield. Right? Somebody could actually come up with the money to study the occupants of Bradfield and then put the windows in. And study them after. It's a beautiful experiment.
I love it. Yeah.
Perfectly controlled.
Let's do it. That's great.
There was a seminal study done a number of years ago, Bill, with residents of a low-income housing project in St. Louis. And when people applied to live there, they were randomly assigned to an apartment, either ones that had a view of greenery, trees, shrubs, turf, or views of parking lots. And they found remarkable, significant differences between the two groups: lower crime, more socialization, etc.
Oh, yeah. The one of the early pictures, I presume that was a European picture. Of
Which one was that?
Well, the two guys working in the office. with
Oh.
all of the photos and everything around.
Yeah, that's a great question. I'd need to go back to the
Very
website where I got that. Yeah.
I mean, I spent a lot of time in Powell, and the difference in window size between them and the US, it's unreal.
Yeah,
And so those common offices like that, and it's not even cubicles, it's not little walled cubicles, it's a much more open thing. So even if you're on the other side of the room, you still see the outside, you still have real sunlight, and you can still see the plants.
interesting. Yeah,
Yeah.
yeah, we have a lot to learn, I think, from biophilic design from other parts of the world, for sure. Yeah. I think you had a question, or we have like one more minute.
Yeah, my question is, you mentioned the perception that plants are kind of dirty. That as a potential is this something that people get hung up on? Are there steps that you have to take when you're putting plants in these medical settings to ensure that they meet certain standards of cleanliness, or can you really just put them anywhere you want and they're considered to be pretty much okay?
Yeah, we were really lucky because of Ken Subin being the chief medical officer. Once you get the approval from someone that high up, you can do a lot actually. And so, but in other experiences that I've had, prior to coming here, I worked for a residency clinic and was trying to do a lot with community gardens and gardens on site. And I think definitely having the buy-in from maintenance as well as upper level administration is essential, but there aren't any regulations around house plants or anything inside by, some governing body. So I think we're out of time, but again, please email me if you have any other questions or.
Thank you
So
so
thank you.
This has been a production of Cornell University, on the web at cornell.edu.